Well, it affects an amazing amount of Americans. It's estimated that somewhere around 26.7% of the total U.S. population affected by various diseases related to arthritis. In fact, there's over 100 different forms of arthritis. And joining us today as our guide, it's a special two-part series on rheumatoid diseases, is a physician who's been there, done that. He had a form of rheumatoid arthritis as a young man, went through what many people do. It was difficult getting the diagnosis, then discovering what his treatment options are. Dr. Goldberg, hello and welcome.
Good morning, Deborah. It's a pleasure to be back again.
Nice to have you join us, and lots to cover today because this is a major topic. If you'll just give us a recap. When we talk about rheumatoid diseases, of course, you look at patients as a whole, but help us to understand that concept, Dr. Goldberg.
Sure. We hear a lot about the terms arthritis and rheumatism, and these mainly are terms, they're very general terms that apply to pains and discomforts and inflammation in the joints and the muscles. But that can be from an injury. It can be from somebody just falling down on their knee. But when we talk about rheumatoid diseases, we're talking about systemic inflammatory conditions that not only affect the joints and the musculature, but affect the entire body. And as you were just mentioning, Deborah, there's about 100 different classifications of those, all of which are, the diagnosis is made based on the signs and the symptoms. And you were also mentioning about the millions of Americans that are afflicted. That's a lot of pain for a lot of people.
Of course, what you get as a pioneer in this area, Dr. Goldberg, connection with digestive health, connection with the immune system. It's not just what's going on in that joint.
Yeah, that's absolutely true. I was at my clinic this past week, and we saw a number of people with rheumatoid diseases. I had about 5 of them sitting in the office at one time, and they were all very, very different. And but one thing was pretty clear when you looked at all these people is that they were miserable, they were unhappy, and there were a lot of different things going on with them. The basic causes of rheumatoid arthritis and the other rheumatoid diseases, I've kind of simplified somewhat in saying there's 2 basic things going on. Mm-hmm. One is that there's a genetic predisposition. It generally runs in families. It doesn't have to be somebody else in the family that had a rheumatoid disease. It might have been somebody else with another autoimmune condition, like ulcerative colitis or Crohn's disease. And the second thing is with environmental factors. We can't do much about our genetics, but we can do a lot to help out with those environmental triggers that set off these rheumatoid disorders.
So when we talk to people about, preventive measures, knowing that last week we were told 1/3 of the American diet is junk food, are there lifestyle factors here that affect these genetic predispositions? Are we putting ourselves at risk by making some of those unwise lifestyle choices, Dr. Goldberg?
Yes, certainly, and that's why we find such a much higher prevalence of the rheumatoid disorders in the United States and other westernized nations than we do a lot of other areas of the world. And the rheumatoid disorders, I think we also mentioned last week, Deborah, are relatively new on the scene. They've only been present for about 10,000 years since we started farming and we began to move to urban areas and cities, and they have been continuing to increase in their incidence and prevalence ever since then. And we're seeing them not only, again, among middle-aged people and elderly people, but in my own practice, I'm seeing them in younger and younger people, kids 2 and 3 years old, which is quite heartbreaking, and people 10, 20, 30 years old, people that should be at their prime of life.
So, dietary factors. We certainly recognize, Walter Willett from Harvard brought it to everyone's attention in Time magazine. Fats have changed dramatically in the last 50 years in this country. The obesity, diabetes epidemic has certainly brought to mind that sugar and artificial sweeteners have changed dramatically in this country. What dietary factors have a role to play here, Dr. Goldberg?
All the things that you mentioned, but I think it's important, we started on this last week, Deborah, for people to understand that when we talk about nutrition, of course, we're not just talking about the dietary factors, and important ones, like you mentioned, refined carbohydrates, refined fats, hydrogenated and trans fatty acids, a diet that's very heavy in seed oils that are very heavy in the omega-6 fatty acids and very low in the omega-3 fatty acids like we find in things like flaxseed oil and fish and so forth. But also changes in the way the gastrointestinal tract is functioning. And I saw one of my patients this past week had both ankylosing spondylitis, a rheumatoid disorder,
Right.
and also ulcerative colitis. And when we see those connections, we see them very, very commonly.
Yeah.
When people are having problems with their GI tract, their digestion, their absorption, their assimilation, and problems with these arthritic conditions, these rheumatoid conditions, there's a very close connection between them. It is fairly rare. I won't say never, but it's fairly rare to see people with rheumatoid disorders that don't also, if at least once you question them,
Right.
don't also have problems with the GI tract.
Absolutely.
There's an important barrier there in the GI tract that separates what I would say is the outside world, the food that we eat, the air we breathe, the water we drink,
Right.
from the inside world, which is our bloodstream itself.
Uh-huh.
And the GI tract is the way that most foreign materials enter into our system. And when that GI tract begins to break down, if a person has a genetic predisposition to rheumatoid disorders, they're very likely to set it off.
So let's talk what's happening to that digestive tract, because birth control pills, steroids, antibiotics are happening to that digestive tract. What role do they have to play here, Dr. Goldberg?
Well, that's a really good question, Deborah, because as important as dietary factors are, there are many other factors that also influence the GI tract. The GI tract holds about 50% of the immune system cells in it, and therefore anything which is going to trigger an immune response is likely to affect the GI tract. One of the big items, and most people are familiar with this, is stress, emotional stress.
Sure.
When people are under stress for long periods of time, the immune system gets stimulated, and eventually, if it continues to get stimulated, it gets exhausted. And the more it gets stimulated, the more it is pressured, it is more likely to react against foreign, not only foreign materials, but fairly harmless materials that may enter into the system. So we have stress. We have people who are living lives where they're in very little contact with the outside world, not getting adequate amounts of fresh air, not getting adequate amounts of sunlight, not in a very busy world, oftentimes not getting enough companionship and comfort from other people as well. So when we start with rheumatoid diseases, the basic place to start is with the general health, and I call that a foundational approach. I explain that to patients. I say, I'm not going to treat your rheumatoid arthritis or your lupus. What we're going to do is treat your general health and get you healthy from the get-go. So we start with the foundations, and those foundations include all those things that people are familiar with but pay too little attention to. The diet they eat, the air they breathe, the water they drink, the amount of sleep and rest they get. And there are a lot of patients who have serious rheumatoid disorders that will have significant improvements when these problems with the basic foundations of health are identified and addressed.
Now, one of the revelations, and if you'll give us a little more insight to attempt to connect the dots, Dr. Goldberg, is the fact that birth control pills, hormone replacement therapy, those drug residues present in our water supply system, of course, the whole use of antibiotics in animals and the products that we eat from them, quite controversial. What role does that have to play in digestive health, and ultimately, who's at risk for these rheumatoid diseases?
Right. Well, the GI tract has in it a number of different bacterial flora, and of course there are actually thousands of different kinds of bacteria and protozoa and different things that line they're in the GI tract. There are many things, many of which you just mentioned, that disturb those normal, particularly important, are the bacteria in the GI tract. Antibiotics that we find in things like poultry and commercial milk, hormones that are found as growth factors in many of these foods, the chickens the poultry that people buy today, almost all of them are given antibiotics and various types of hormones to make them grow faster. The water we drink has chlorine in it, and chlorine has done a wonderful job of eliminating a lot of infectious diseases that plagued this country in the beginning of the 20th century. But today it also disturbs, particularly when we drink it day after day, it disturbs the natural bacteria in the bowel. Well, when those get disturbed, and the lining of the GI tract also gets disturbed, once again, the outside world, the things that we eat, the things that we drink, are able to get through the lining of the GI tract, get into the body, and upset the immune system. And if the person has a predisposition already to rheumatoid disorders, those are the kind of things that can set it off. So when you mention birth control pills and antibiotics and hormones, those are all things people need to consider really carefully in terms not only of prevention, avoiding getting these rheumatoid disorders,
Right.
but also eliminating in order to recover from them.
Speaking of confusion, when we return, Dr. Goldberg, many of us confused about, okay, if I need good bacteria, how do I choose products? What are some of the factors to consider? Dr. Paul Goldberg joining us today, Rheumatoid Diseases. I'm Deborah Ray. We're talking about rheumatoid diseases, arthritis, rheumatoid arthritis, autoimmune conditions with Dr. Paul Goldberg joining us today. You're invited to join us. It's 1-800-307-3002. Now, treating inflammation. Of course, we recognize non-steroidal anti-inflammatory drugs, significant downside. The prescription ones, significant downsides. You mentioned for your information. Tell us a little bit more about this, Dr. Goldberg.
FYI, for your inflammation, Deborah, for your inflammation, yeah. Inflammation, as many of your listeners know, is a common accompaniment to many types of health problems, and we shouldn't look at inflammation as our enemy. But when the body is expressing a lot of inflammation, when we have a high C-reactive protein level and a high SED rate and the joints are swollen, it's a sign that things are getting a little out of hand. The wrong thing to do is to suppress these things by taking things such as corticosteroids and other immune suppressant drugs. The right thing to do is to find out why those things are happening and get down to the roots of it.
Now, many people may already be taking drugs, and of course, then the confusion, Dr. Goldberg. Am I somehow interfering with the drugs? Probably more properly, are the drugs interfering with the nutritional approach? Is it a factor for consideration?
Yes, it is. And this past week at our clinic, I saw a lady that came to see me from out of state, as a lot of our clients do, and she has rheumatoid arthritis, and she was on 6 different prescription drugs, including steroids, and she was also taking a very strong immune-modulating drug called Enbrel, along with non-steroidal anti-inflammatories. And these have many, many interfering actions on the nutritional processes of the body. They not only affect the immune system, they affect the digestive tract. Some of the non-steroidal anti-inflammatory drugs, everything from Tylenol to ibuprofen and aspirin, these things can bring about some mild temporary relief, but they do so at a high cost. They damage the GI tract, they increase intestinal permeability, and as with steroids, they are kind of an enjoy now, and you're going to pay like heck later for it.
Yeah, many folks, who are, just forced to use steroids from the standpoint of, that the physician is stumped, really want to get off those drugs, Dr. Goldberg.
Right. And they have to do it carefully. Once they're on it, I certainly at the Goldberg Clinic, we don't just take patients, get them off steroids immediately. If they're taking high doses of them, they have to come down off of it gradually. But for many patients, if they try to do it on their own or just with a physician who's not educated well in the foundations of health, it can be a very, very precarious situation. So while they're coming down off the steroids, concurrent to that, they have to get enough rest and sleep. They need to improve the diet, and individual factors need to be addressed. And I want to encourage your listeners again to go on our website, www.goldbergclinic.com, and there's an article they can download for free on that website called Infinite Variety. And it talks about not only the foundations of health that are so important, but also about the individual factors that people need to look at. And, as we're just talking about, the various drugs that are on the market today. And speaking of those drugs, there's a whole new group of immune-modulating drugs, such as Enbrel and Remicade, and they produce very, very dramatic improvements in patient symptoms.
And
but
scary side effects.
Already I've seen some very dire consequences of people taking those.
Scary side effects, absolutely. Do the risk outweigh the benefit? It's a valid question. Well,
I had one patient come in that actually developed tuberculosis as a result of being on one of those.
Wow. Well, you have given us very valid options, all science-based, and a great source of information to find out more. Dr. Goldberg, great job. Thank you so much.
Thank you, Deborah.
Dr. Paul Goldberg joining us today. We've been talking about autoimmune conditions, rheumatoid diseases, and as he indicated, you can download a free article online at goldbergclinic.com. Thanks so much for joining us today. I'm Deborah Ray reminding you, live long, stay healthy.